So hello everyone and welcome to the Mindful Medics. Today I am delighted to have Dr. Meredith Broderick as my guest. Dr. Broderick is a board-certified neurologist with a specialism in sleep medicine. She studied for her undergraduate and medical degree at The Ohio State University. She is licensed in Washington State, Alaska, and California. As well as practicing conventional medicine for over 12 years, Dr. Broderick has extensive background in allopathic sleep medicine, and she incorporates the latest evidence-based research on behavioral sleep medicine to create customized sleep plans to minimize the use of medications. And her practice is called Sound Sleep Guru. So welcome, Dr. Broderick.
Thank you for having me.
It's an absolute pleasure. Good to have you on the show. So let's kick off. I'd love to know a little bit about your early life and what inspired you to pursue a career in medicine.
I would love to tell you. I was adopted by my parents from South Korea when I was 6 months old. And they were high school sweethearts who lived in a small town in northeastern Ohio. And so one of the things I think that was a huge influence on me was my mother was a professor at a medical school there. And also we have a long line of physicians in our family. And it's sort of got interrupted by World War II because my grandfather, my mom's father, he really wanted to be a physician because it was part of their family story. His grandfather was one of the first graduates of UVA medical school. And he actually had ridden on horseback and, done all these heroic things and was a really important part of their story. But because he served in World War II and was gone for so long, he felt that he was too old to go to medical school. But I always heard these stories about these doctors, and I just knew that it was something really important to serve others and healing. So that was really inspiring to me. And I think that in combination with my mother being on faculty at a medical school, I got to see things like a human brain when I was very young, maybe like 8 or 9 years old, and got to see cadavers before, in junior high. And it just really, it was so fascinating to me.
Wow, that's incredible. What an amazing start to life. And it sounds like you have an amazing family. So that is wonderful. Thank you for sharing that. Tell me what led to you going into neurology and then into sleep medicine.
For neurology, it was very organic. I really loved neuroscience and I loved the Sherlock Holmes quality to neurology in that it's very detail oriented, knowing a lot about that person's life in terms of where they were born, what kind of environment they live in, what type of work they do, and all of the things that go along with the neurologic exam and just the nature of neurological disease, how it evolves so slowly. You have to have a different sort of mindset for it. I know a lot of people actually don't like it because of that. It's kind of slow moving in a way and less exciting. But I just fell in love with that. I just thought it was so beautiful. I loved Oliver Sacks, as a younger person. I thought that kind of detail oriented vantage point about patients and about caring for people was really fascinating and very interesting. And so I just chose that. I mean, essentially the answer is very simple. I loved it. I was very attracted to it. It's what I enjoyed the most of any of the rotations.
That's a wonderful reason. I love that.
Yeah.
Absolutely. And what took you into the specialism of sleep medicine?
So even though I really love neurology,
Yeah.
one of the things that I really struggled with as a resident is, a lot of medical training revolves around inpatient medicine rather than outpatient. And so for neurology, stroke is really that's like 80%, or that might be a little high, but let's say 75% of what you're doing as a resident was stroke and neurointensive care. So my residency was very demanding, very grueling, and I really struggled with the sleep aspect of it. And one of the faculty members where I trained just pulled me aside. I mean, I think she could tell my angst with it, not only because of the demanding nature of it, but also the angst that I felt about not being able to help people to the
Mm.
degree that I wanted to. I think when I went into medicine, I had this idea that I was going to be curing all these people and doing all these heroic things. And really, a lot of times when you're dealing with something like a neurodegenerative disease, a stroke, you're really just helping people adapt and manage something that it's too late almost to like totally reverse it. And so this faculty member said, you might be interested in sleep medicine. There's the best program in the world is at Stanford. You should go there for an elective and see what you think. And so I did do that. I actually took my 2 of my 4 weeks of vacation, my PGY 3 year, and I went there, and these were people who were talking about prevention. These are people who were talking, I think when people I hear about like functional medicine and longevity medicine these days, I think, we were doing that in sleep medicine before these things became a fad.
Yeah, I love that. Absolutely. And sleep medicine is having its heyday now, I think. I'm giving away my age here. But I became a doctor 30 years ago in the UK, and sleep medicine was in its absolute infancy, if it even existed. I don't honestly know if it even
Yeah.
existed back then. And certainly in the medical profession, there was this kind of attitude of, sleep is for the weak, and I'll sleep when I'm dead, type of thing. And it it took a toll. It also took a toll on me. I have to say, the sleep deprivation did not go well for me at all, and I think it didn't honestly go well for anybody. And
Yeah.
but I think the research that's been coming out in the last, I don't know, 10 to 15 years on sleep medicine, and how sleep is in the top 5 of the most important things that a human being can do for their health, and especially for their brain health. So what a
Yeah.
wonderful time to be in it. And like you say, the fact that it's funny, I was a public health doctor in the UK, so that was about, how can we improve the health of populations, and how can we empower people to take responsibility for their health, and prevent illness. And clearly in sleep medicine, you're having a huge role in that goal. So it's wonderful.
Yeah. I mean, I'm not going to lie. When I chose it as a subspecialty, the faculty where I trained definitely told me, like, that's not a real specialty. Like, why are you doing that? And
Mm.
if we're not have for having gone somewhere like really prestigious, like Stanford, where I saw that it was looked at differently there, I probably wouldn't have chosen it.
Yeah, absolutely. It was a brave choice.
Yeah.
I
A
love
lot of
it.
people were like, "Is that a real specialty?"
Yeah,
They
yeah.
didn't get it. But I
Okay.
just it was important to me, and I decided it was what I wanted to do.
Yeah. I loved something you said earlier. You mentioned about being like a Sherlock Holmes. I think when I'm talking to lay people about, what it was like being a doctor, and I'm not practicing anymore, but I would say, it's like a combination of being a detective and a researcher. You're constantly trying to get clues as to what's going on, and sometimes you have to dig really deep, and you have to go back really far, and then you go into the phase of, okay, well, I think I know what's going on, and now I need to experiment and see what works for this completely unique human being. So
Mhm.
it's a great way to look at it. Fantastic. So tell me, how was you mentioned a little bit about how medical training and your early career was. Did you face any kind of major challenges during that time?
I think it took me a long time to figure out how to practice the way that I want to. So I started in academics. I sort of saw myself as someone who would be in academics. I think because of my mother, she was a full tenured professor. She was a career in medicine. And I thought that's really, the most prestigious way is to be an academic. And I sort of saw myself, but, I started my career in academics, and I realized for a lot of reasons that it just wasn't the right fit for me, and that was a little bit difficult for me to come to grips with. And then I went to private practice, and there's separate issues with private practice. And then, slowly medicine has changed a lot where, because I think in my mind, it's mostly because of insurance companies.
Mm,
Um, you, I couldn't be as patient centered as I wanted to be.
yeah.
And that really bothered me. And so that's what ultimately led me to start my own solo practice. And, obviously there's some obstacles with that, but I would say that's the main barrier that I sort of struggled with, was just trying to find the right, the right way to practice, the right practice setting. And it turns out for me, I just needed to sort of go through those growing pains.
Yeah, absolutely. It's funny. I often say to people, I've had my dream job twice in my life, and both times it was a case of be careful what you wish for because you just might get it, and when you get it, you might hate it. That was kind of my experience where I really thought I knew what I wanted to do, but the reality of the job was not what I expected at all. So I can
Mhm.
totally relate, and I'm sure a lot of people can as well. We're often, especially when we decide from an early age that we want to go into medicine, you kind of have this vision of your future, and often you have to pivot and reinvent yourself a lot along the way. So
Yeah, I
yeah.
agree with that.
So tell me, how do you think the medical profession has changed since you began your career?
Well, the one thing that I've experienced is there is such a demand for physicians to be productive, and it's a never ending process of more and more RVUs. At least that's what I experienced. And I think just this pressure to deliver a lot of volume,
Yeah.
I think that's changed. I mean, what I'm seeing change is really what's happening with technology, where there's a lot of information online. There's a lot of information on social media. I think younger people are seeking out medical advice online. That's another big change.
Mm,
Um, but I don't know. I mean, there just aren't that many solo practitioners anymore. Like, these big companies are gobbling up, and basically having like monopolies, or I don't know if they're monopolies, but where there'll be only like two or three big systems, like in a big
mm,
metropolitan area, and then really no independent doctors. And so everything is sort of volume based, like cookie cutter. Um,
yeah.
that's one big change. And then two is the technology, I would say.
Yes, absolutely. And the technology has its pros and its cons. And you and I met through Instagram.
Yeah,
I
that's
hate
right.
to say it, but yeah, I've been following you for a while on Instagram, and it's there's a wonderful aspect to it because I think it brings access to wonderful information to people, but it also, of course, it's kind of too much information and it's hard to control the quality of it too, and that's a huge challenge today. I'm sure I used to get it when I was a general practitioner in the UK, people coming in and saying, doctor, I've got diabetes, or I've got sleep apnea, whatever it was, and I'd say, can we have a conversation before I make a diagnosis, rather than you telling me. But I imagine that's even worse today with the access to information.
Yeah, I
Yeah.
agree.
Yeah.
It's just double-edged sword.
I totally. So tell me, what have you used during your career? I'm sure you've had times of stress. What have you found to be useful in your career to keep yourself grounded and calm and feeling happy and fulfilled?
I think the biggest one has been outdoors and nature combined with physical activity, and integrating that consistently into my life, but also in large chunks at times. And I certainly had more bandwidth for that before I had kids. And now I have little kids, so it's a little bit trickier, and it's a little bit more, like, get it when you can. But
Yeah.
I think that's been a huge thing for me, and not just in the way you might expect it, but I spent a great part of my 30s learning how to get out on like alpine climbs, technical rock climbing, big mountain expeditions. And, as a woman, I don't know if it's just a woman, I think it's for any gender, but in particularly for me, I found it to be very empowering. There was a time in my life when I was so physically strong that I was stronger than my husband, who's quite a bit bigger than me, just because I was training to carry like 70-pound packs for 13 hours, walking uphill at altitude. And to be able to do something like that, to climb a mountain like, I've climbed Denali in Alaska, which not very many women do because you are required to carry everything you need for a month on your back and in a
Hmm.
sled. I think that knowing you can take care of yourself and you're strong enough to do that, I think it's so empowering. And it also helped me realize that I don't need that much to be happy. And so it was
Mm.
sort of a lot easier for me to kind of give up that golden ticket of that sure thing salary from like a big corporation and just say, I'm going to try this on my own and I'm going to not make a lot of money for a little while, but I'm going to go for something that's bigger and I'm
Mm.
willing to take that risk. And it really helped me learn how to like take risks in a way that I don't know that I really would have been able to do that or trust myself. And I think that's something that really has made a difference for me. So, not just like the usual benefits of being outdoors, but understanding that sometimes you have to have a lot of pressure placed on you to
Mm.
make big changes in your life and to understand the importance of taking risks.
Oh my goodness, I love that so much. And I think the physical resilience that you build has clearly built a huge amount of mental resilience as well.
Oh, yeah, that's exactly right,
Yeah.
because that's what it is. It's you learn to increasingly become uncomfortable and to know you're fine
Yes, absolutely.
and that
And
you're gonna keep going.
yeah, I also loved what you said about, I think we're often, told this is the life that, we should be living in today's society. And I think I I see this in coaching since COVID. A lot more people are questioning that. Do I need to live my life the way that everybody else is living their life? And I personally think it's a really good thing that more people are questioning that. I don't have to, I don't have to go for the whole consumer driven life where I want a bigger house every 5 years. I want to always be driving the biggest car that I can afford. And in order to achieve that, I have to, work in a certain way. People are really starting to realize that you can more intentionally design your life and create a life that the unique, very special you will enjoy and feel good about.
Yeah, I mean, I will say the other thing about those experiences is I met a lot of it sort of sub-selects for a certain type of person, and I came across a lot of people. I mean, there's this whole lingo and subculture with it, right? But they call themselves dirt bags and things
Oh,
like
really?
yeah, because I mean, and that's the thing is like when you are around groups of people like that, they don't value the same things as maybe in the culture of medicine, for instance, like titles and, you know, publications and all this stuff. And what I realize is like being around people who don't care about how much money they make and they have so much more freedom than you do and so much more joy and happiness, you go, wait a minute, what the
Yeah.
hell am I doing? What the hell am I doing with my life? And then I feel like I'm just in this like conveyor belt, you know, corporate setting where no one gives a shit about how excuse I don't know if I can swear, but no one gives a crap about the quality of work I'm doing. All they care is about how many people I can see,
Yeah.
and they don't care about the patients. I thought something's wrong here, and you
Yeah.
kind of recenter yourself out of that context. You take yourself into a totally different context, it's very powerful to help you question what you're doing and say, hey, maybe the reason I don't feel good about this, you know, what is that about?
Yeah, absolutely. Absolutely. Tell me, do you specifically practice any mindfulness or meditation, or is being out in nature your mindfulness practice?
I do. I would say there are times in my life where I have specifically meditated, and I would often combine it with yoga. So I would do a yoga practice and then have like a meditation at the end of it. But a lot of the things that I do where I sort of consider it like a habit stacking thing where there's exercise combined with light exposure, combined with being outside, combined with like a mindfulness type practice. So a lot of these like repetitive activities like hiking, walking, running, swimming, they all have a very meditative quality to me. And so, like, for instance, I'm not going to be listening to anything or
Mm,
trying to do work, but really just focusing on being in the present moment or focusing on breathing. That's one reason why I really like swimming is you really do have to focus on your breath a lot, just
mm,
because of the physical nature of like coming up for air. And same thing with like high altitude climbing and things like that, because you are so taxed. You have to force yourself to breathe in a way. And so I think a lot of things I do have a meditative quality to it. But to be honest, I don't like right now, I don't have like a meditation practice like regularly where I sit for it.
yes, absolutely. No, and I love what you said about the combination of being outside, physical exertion, light exposure, which, the neuroscience research on that in the last few years has shown how, especially in the morning, it's incredibly important for the sleep wake cycle. And it's a wonderful thing to be combining combining all of those benefits into one practice. So I think that's wonderful. You don't need to be sitting meditating. I think you're probably doing enough. Tell me, based off of your career in medicine and especially neurology and sleep medicine, what would you say are three top pieces of advice for medical students, medical professionals, but also for the general public on what they can do to stay healthy and live their best lives?
Yeah. So one of the things I always tell people as a neurologist, and this goes back to my training, is I think some people focus almost like too literally on sleep.
Hmm.
Um, and if you really want to take care of your body, if you really want to think about brain health, I think that vascular disease and vascular risk prevention, cardiovascular, I mean, I think of cerebrovascular disease as being really synonymous with cardiovascular disease. It's not literally, but there's a lot of it that's overlapping, right? It's vascular disease.
Yeah.
I think that that is such a important role in brain health that people really underestimate. We sort of think of like Alzheimer's dementia as being like something different, but
Mm,
these things are very interrelated. Um, there's this whole idea that's emerging now that these things are really interrelated because this cleansing of the brain is very dependent on the vascular system being intact. And we see this all the time when we look at MRIs, every day of our patients. But also, sleep is a vascular event in the way because if you just think about, for instance, how our body temperature has to lower, that's a function of the autonomic nervous system and it's a function of the vascular system of
mm,
transferring this heat from our extremities to the core. And so, for instance, this is one of the reasons why I think that exercise is so beneficial for sleep is because it demands a lot on our cardiovascular system, our autonomic nervous system. And so that's the first tip is that I would say is that if you want to improve your sleep and you want to keep your brain healthy, you have to have good vascular health. And I think a lot of people
mm,
don't think about that, how that's intertwined. The second thing is, I would say, snoring is the precursor disease to obstructive sleep apnea, which is a precursor disease to high blood pressure, cardiovascular disease. And I think a lot of people really underestimate that and misunderstand what the signs and symptoms are. It's just like a lot of the other things where women really manifest differently. They don't gasp and choke
Mm,
and fall asleep in a recliner the way men do. And I think they are not diagnosed. A lot of times it's more like insomnia.
mm,
Um, and then the third thing that I would say is, you just have to have the right mindset, I think, about sleep, that it's a process that's lifelong, and the way it's going to be healthy for you is going to change over time
mm,
in the sense of what works for you, and just being committed more to the process than an outcome. Like, I think people are getting very focused into like sleep duration on their sleep tracker, and it's just too narrow um and too specific of a goal. Like, you want to kind of zoom out and have a broader view.
interesting. And I know you and I have had a quick conversation on Instagram about sleep trackers. I have the Aura Ring,
Yeah.
which I found really, like we were talking about being a Sherlock Holmes earlier, was really useful for me figuring out what was going on with my body, and with I actually found that sugar was a big part of some problems I was having, especially with sleep. But what is your, I would say, I don't know what the percentage of people that have some sort of tracker, whether it be an Apple Watch or some sort of ring device. Um, any cautions about these devices?
I think the main caution is just there's really two sides to it. One is it's not a treatment of a sleep disorder. And so I really want people to know, if you're having major time with insomnia or daytime sleepiness or other sleep issues, like, you need to get help and you need to get guidance. Like, that tracker is not going to solve your problem. It's there for you to help make observations and take a closer look, and for you to do things to make changes like you're talking about with your blood sugar. Um, that's really important, and I think that's great and empowering people. The second thing I would say is some people become really obsessed about it, and I think they put too much importance on it.
Yeah.
Like, I don't like sleep scores. I don't like the concept. To me, it's very synonymous to having a beauty standard, in
Mm,
that it's something that is inherently elitist, because not everyone has the convenience or the privilege to optimize their sleep score. Not everyone has the ability to do all those things and sit in the gym all day and eat, organic food. What I don't want is for people who really that's unattainable for them. You know, for instance, a mother with a newborn baby, a person who's caring for someone with Alzheimer's disease that's wandering in the night, is I don't want them to get that negative feedback.
yeah.
And it turns out there are actually people who want to work the night shift. And despite all the negative consequences of that and being fully aware of it, they choose that for certain reasons.
Mm,
And the same way that someone might choose to ride a motorcycle or to go on dangerous, I don't know, fishing expeditions. Like, people do want to take risks in their lives. And I think this idea of having this standard and telling people how they feel and telling people how they're doing, there is something negative about that, the same way
mhm,
beauty standards can be negative. Now, my view on it is we do need to start somewhere with our understanding of how to help people and guide people. And that goes back to this double edged idea about technology. But for me, I want to have a more expansive view. And obviously, I'm biased because I see people that are not necessarily coming to me for sleep health or wellness. They're coming to me because they have a sleep disorder. I mean,
mm.
it's reached a certain threshold. So I think that's the important thing is um, just to think about those differences and context and how to use it the right way.
I love that. Thank you for giving us your take on that. So tell us all, is there anything that you are currently working on right now, or is there anything that you'd like the audience to know about you and about the work that you do?
The one project I'm working on right now, I'm really excited about, is I'm a medical advisor for a tech company called Oslo Sleep. And they have a wearable and a nearable. And what they're really looking to do is to give people information about not only their environment from the nearable and wearable data, but they're also hoping to deliver solutions to people. And so because their wearable is in ear, they can deliver things like noise masking, they can deliver things like soundscapes. And I just heard a fascinating lecture yesterday. I heard this crazy statistic yesterday that we're going to spend 20 years of our life scrolling on a phone. And one of the antidotes that the psychologist from NYU suggested was, connecting to nature. And some of us don't always have the convenience of being able to like go on a hike during the day. But what we can do is take 5 minutes to listen to a waterfall or, some kind of nature soundscape. And that has been shown to be beneficial. So, also things like tinnitus and other medical issues. But I'm really excited about that. I'm excited about tech companies that really want to partner with people who are clinicians and not just scientists. That really excites me. And to have the ability to partner with them to put out like high quality information and reach a greater platform is very fulfilling to me.
I love that. Wow, I hadn't heard about any of that, so I can't wait to see more of that coming out. Remind me of the name of the company again.
It's called Oslo Sleep, and it was founded by 3 engineers who basically took the intellectual property for these sleep buds from Bose, the company,
Yes.
And started their own spinoff company.
Fantastic. That sounds very exciting. So, and by the way, we'll be sharing all the links to Dr. Broderick's practice below, and you can connect with her on social media as well. And just a reminder, her practice is called Sound Sleep Guru. So, Dr. Broderick, it has been an absolute joy to interview you today and to talk with you. And I think we could talk for many hours on a wide variety of subjects, but it has been an absolute pleasure. Thank you so much for your time today.
Oh, thank you for having me.
You're very welcome. So everyone, I hope you have enjoyed this episode, and I wish you all much health, happiness, and abundance. Bye for now.